now going to mark the shoulder by outlining the acromion and the anterior lateral margin of the acromion. All right, I'm palpating here, and I'm feeling the anterior lateral aspect, and we'll put an X there, and then we'll feel at the joint, feel the anterior edge of the clavicle, and then the anterior edge of the acromion, and then the side of the acromion. And what we do is I have to visualize going in either anteriorly or laterally. In her case, we'll avoid the anterior portion and we'll come in from the lateral side. So we'll make the injection starting here, visualizing coming underneath the acromion at this stage so that you don't impinge on the acromion and come in underneath the deltoid insertion. First step is go ahead and prep the shoulder. Several articles have shown that it's not necessary to use a sterile field in the concept of squaring it off and doing that, but you do have to be mindful not to contaminate the field after you prepare it. And also, it's best to prepare it while you're in the room with the patient, because if you leave the room, then they may check the shoulder, it may be aching and hurting, so you want to make sure it's not contaminated. And once we do that, we have the patient lie down. Now, the reason that we have the patients get into the supine position is because there's a high frequency of holding one's breath and then having a vasovagal reaction. So I've always had the patients lie down no matter what injection, whether it's into the shoulder, the knee, the greater tuberosity, the greater trochanter, or even the elbow, because it makes them more relaxed, which decreases muscle tension and then also keeps them from having the vasovagal. If they were to have the vasovagal, then they're also in the position where they're not going to hurt themselves. Now, what we're going to do now is we're going to palpate again over here to get the lateral edge of the acromion. And for pain relief, we're going to spray some ethyl chloride and then inject right underneath here. And we'll feel, there we go, a wince to let you know that you're in the proper area, which is actually good because it should help. Now we're just going to slowly inject. You can see a little bit of swelling there, so we need to come in a little bit more medial. And coming in there. Coming a little bit more toward the anterior portion. And again, you have to feel your way along here in that she has some scar tissue in here from a previous surgery, and we have to feel where the shoulder is going to allow the injection to progress. And as you get significant back pressure, you have to move and feel as you're going in. There it's slipped in. Now I don't feel any more solution coming out the top. So we're going to continue to inject, and then you can feel that the injection gives away, and then we're done. Another common reason for injecting in the body is for greater trochanteric burst